Hello learners, I am Aparna Sharma, home scientist, and today we will discuss about the most important aspect of our entire curriculum, that is life begins. Life begins with fertilization of the egg of a woman and sperm of a man within the womb of a woman only. It is the blessing of nature that woman can give birth to a new life, and this happens only with the fertilization of the egg and the sperm. In this lesson, we will learn the life stages from conception to the beginning of life of a baby, signs of pregnancy and changes taking place in the woman's body, development of the baby in the 3 trimesters, prenatal care, that is the care during pregnancy, postnatal, that is the care to be taken after pregnancy, significance of breastfeeding and bottle feeding, and the immunization schedule for the baby. Pregnancy, we all know, is the state of the female body when the unborn fetus develops in the womb. The process of producing the child is reproduction. When the fertilization of the sperm and the ovum takes place, it leads to the condition called pregnancy. Both man and women are responsible for bringing the baby in the world. Woman carries the egg and the man carries the sperm. After the sexual contact between the man and the woman, there is the possibility of fertilization, that is uniting the egg with the sperm. As you can see here, this is the ovum, whereas this is the sperm. When they combine, it forms the zygote, and zygote turns into an embryo. This is the process of fertilization. After fertilization, the united body is called the zygote. Zygote soon gets attached to the uterus, which is present in the lower abdomen in the woman's body, and the first 3 weeks it is called the embryo. After that, it is called the fetus, and the fetus, it is attached to the mother through the cord, which is called the placenta. So, from the fertilization, it goes from zygote to embryo to the fetus. The whole process occurs inside the uterus or womb of the woman till the child is born. On delivery, the fetus comes out and it is now called a newborn baby. The whole process takes about 9 months or 40 weeks to be completed. So, the entire duration of pregnancy is about 40 weeks. What are the signs of pregnancy? How does a woman come to know that she is pregnant? Missing of the menstrual period, confirming that the lady is pregnant by using a laboratory, getting tested in the laboratory or using a pregnancy test kit, having morning sickness, nausea or vomiting, changes in the breast, it becomes darker, the tender, and the nipple area becomes darker, alteration in the urination and hunger, and excessive craving for certain foods like pickles, spicy food, or there may also be aversion from certain foods or tastes or smells. We have seen how the zygote changes into fetus and how does a mother come to know that the lady come to know that she is pregnant. Now, what are the factors that affect the growing fetus? When the fetus is in the mother's womb, there are certain conditions that the mother must take care of so that she has a healthy fetus. Emotional state of the pregnant woman. The pregnant lady must be happy at all times. Diet or nutrition during pregnancy, changes in the body weight, regular medical checkup, taking medicines, disease germs that affect the fetus, mother must be careful to see that she does not contact them. Mother must not take drugs, alcohol or indulge into smoking. The clothes that the mother wears should be comfortable, and other factors like exposure to chemical pollution or environmental hazards. These are the factors which will affect the growing fetus, and therefore the mother should be very careful of. We have said mother's emotional status. Mother must be happy during pregnancy. It is believed that the happy mother gives birth to a happy baby. A pregnant lady must avoid tension and stress. Tension and stress results into the release of hormones which affect the baby. The mother's emotion of anxiety, distress, fear or grief affects the baby, and the baby may be irritable after birth, will not be in a happy state. Other than the emotional status, mother has to maintain good dietary intake. Increase intake of protein rich food. Why she requires more protein? Because she must have adequate protein for the increase of formation of the mammary glands, functioning of the mammary glands, and also for the growth of the fetus. New cells and tissues are being formed, so she must have a protein rich diet. Increase intake of complex carbohydrate food, increase intake of iron rich food and vitamin rich food, include foods which are rich in omega-3 fatty acids, calciums and carotenoids, avoid alcohol, caffeine and tannin rich foods like tea and coffee. She must reduce intake of salt, sugar and refined food, regularly drink 8 to 10 glasses of water, eat small size meals at a time and take food several times at regular intervals, avoid processed food and consume freshly prepared food. Why? Because processed foods contain artificial colors or preservatives. Eat fresh fruits and vegetables, and they are always much healthier. Other than the emotional state and good dietary intake, another important factor which affects the fetus is the age of the mother. This is a very important factor. Age of mother more than 35 and less than 20 has been found to affect pregnancy. Teenage pregnancy, if the girl gets pregnant at an age less than 20, the condition is called teenage pregnancy. It is a dual-edged sword, because there is physiological demand for growth of adolescence and then there is additional demand of pregnancy. Pregnancy at an age later than 35 to 40 years may cause problems like delivery complication, prolonged labor, and infant may be born with health problems. In both the cases, woman is exposed to high risk of pregnancy, that is age less than 20 or more than 35. If the mother takes medicine during pregnancy, the intake should be minimum. Medicine pass through the placenta and some of them can harm the baby, hence the medicines are not preferred during pregnancy. Iron tablets should be given to pregnant lady because they are not medicine, they are nutrient supplement, and tetanus injection should be given to a pregnant lady. This is to take care of the lady while pregnancy and also of the baby when it will be born. That is to take care, and this is a precautionary measure to avoid any complications during the time of partition or delivery. Disease germs that affect fetus. When mother is not well nourished, she is at a high risk of infection. If a mother catches diseases like German measles or sexually transmitted infections like AIDS, HIV, their germs can pass through the thin placental wall and can damage the growing fetus. Mothers must therefore be very careful during pregnancy so that they do not catch infections. During pregnancy, if the mother uses drugs or indulges into smoking or alcohol consumption, it is very, very harmful because it can lead to complications in the child like low birth weight, stillbirth, neurological problem or behavioral difficulties in the child. It may also cause serious health hazards in the children which become visible at a later age. Prenatal care is very important during pregnancy. When we say prenatal care, what is it? The medical checkup that is required, regular medical checkup of the mother, monitoring of the body weight, taking regular medicines, the clothes that should be worn by the mother, and regular exercise and rest. Both is important. Mother should not be under continuous rest or should not be continuously exerting herself. It is very important to strike a balance between exercise and medicine and the rest that the mother is taking. When we say prenatal care, it means body weight, the clothes, as you can see in this picture, the clothes should be comfortable, it should not be hurting the lady. The regular medical checkup is done to see whether regularly the weight is increasing or not, blood pressure is normal or not, and regular exercise happening. Taking of medicine should be under absolute supervision of the doctor and instructions of the doctor. When we say medical checkup starts with the confirmation of the pregnancy test. This can be done in the laboratory or by using the pregnancy testing kit. This should be done by trained health professionals. In villages, one can go to an ASHA worker, that is the person to be found in Anganwadi or primary health center, or one can approach the hospital as well. Blood test is required if the mother is having anemia or any other health issue including HIV/AIDS. To ensure safe motherhood and delivery, visit the doctor at least once a month in the first 8 months of pregnancy and once a week during the last month of pregnancy. This is to avoid any kind of last minute complications. Body weight. A pregnant woman gains weight as the fetus grows. Normally, she should gain on an average 12 kg. This indicates healthy growth of the baby. If the mother is increasing weight at a normal pace, then it indicates that the fetus is also growing in a healthy manner. Rest and exercise, we have said earlier also, is very important. Pregnant woman should remain active, cheerful and continue to perform her daily activities. She should walk regularly and carefully in open air. She should take care to avoid any fall or injury. She should also take adequate rest and sleep, approximately 8 to 10 hours. She should avoid any kind of physical or mental exhaustion or stress. Any kind of stress, anxiety, worry, tension will affect the baby immediately. She should take some family support and avoid staying and working alone. And any bed rest, if it has been guided by the doctor, it should be followed. One should not avoid that. We have been talking about the prenatal care, that is where before the baby is born. Once the baby is born, then we need to give postnatal care. Postnatal care is the care given after delivery of the baby. It implies care after delivery or care of the newborn and the mother. Now, in postnatal stage, both have to be taken care of. Hygiene, this is very, very important because till the time the baby is in the mother's womb, he or she is in an extremely protected environment. Now, once a child comes out into the regular world or in the surroundings, hygiene is a very important factor. Cleaning of the newborn, cord and the delivery room, nutrition, breastfeeding and bottle feeding and the meal of the mother needs to be taken care of, and regular immunization. Immunization is very important again because these are the steps that are the prevention of certain very life-taking serious diseases. So, at regular intervals as per the instruction of the doctor, immunization of the baby is very important. When we say hygiene, it is cleaning of the newborn, care of the cord and the new mother. Just after delivery, it is necessary to clean the baby using soft wipes and warm water. Do not scrub. You can see in this picture, there is this sticky material on the body of the baby. The sticky material on the skin and the hair, etc., are the protective lining. They will fall off on their own. There is no need to scrub them off. When we say care of the cord, umbilical cord is the placenta which connects the baby to the mother. Soon after delivery, it comes out from the uterus. The baby is separated from the placenta by cutting the cord near the navel. It is very necessary to protect the cord from infection and it should be dried naturally. Not only the baby, it is the new mother also who needs to be taken care of, and we should see to it that she is also clean, her clothes, bed and the room and other articles that she is using are all clean. The stitches should be cleaned and kept dry to avoid any infection. If the mother has been given stitches, then the stitches also need to be taken care of. Immunization is very important because it is the tool that protects the newborn from infectious and dreadful diseases like TB, tuberculosis, diphtheria, polio, etc. They are available in forms of drops or injections. Sometimes they exhibit symptoms like fever and rashes that are just reactions and subside within few days but protect from the disease. When the injection is given to the baby, it is just an external feature that rashes or fever may happen to the child, but that is not at all to worry. It is the way the body is reacting to that particular injection or oral drop that has been given. Another important thing is that it should be done at the prescribed timing. It is very important to maintain the time schedule, otherwise the impact of this medicine will not be long lasting. Now, we have been talking about the pregnant lady, that is when the mother is carrying the baby in the womb. Next important stage is the nutrition for lactating mother. Once the mother starts breastfeeding the baby, the condition or the mother is now known as a lactating mother. It is best for the baby to be put on mother's breast from first hour after birth. Immediately after delivery, mother produces a thick yellowish fluid that is called colostrum. This colostrum provides lifelong immunity to the baby and prevents infection. It is very rich in nutrients and it is released only for the first 3 to 5 days. It is very important for the mother who is feeding the baby to feed the colostrum as well. By feeding that, we are developing the ability in the body of the child to fight against various diseases and infections. A lactating mother has to take very good care of her diet as well. That is, increase intake of protein and calcium rich food such as egg, milk, nuts, oil seeds, etc. Increase galactogenous food like methi seed, cumin seed, garlic, fennel seed in various food preparations, and increase intake of vitamin A and C rich foods. There has to be increased intake of protein and calcium foods. Mostly foods that supply protein also give calcium. Increase in these kind of food intakes, as you can see in the picture here, it helps in taking good care of the baby. One must avoid foods which have alcohol, tea, coffee, cola, and a lactating mother must not smoke. Regular intake of 8 to 10 glasses of water is very important, and the lactating mother must eat breakfast which has nutrient dense food and must have food at regular intervals of the day. We have been talking about breastfeeding and the importance of giving mother's milk to the baby because it has several advantages. That is, it ensures adequacy of food for 4 to 6 months. Baby will get good food intake, good food supply for 4 to 6 months. It strengthens the mother-child bonding. It helps in developing a very strong relationship between the mother and the child. It helps in birth spacing, benefits the mother's health, helps the uterus to take back its original shape. It is safe, pure and just of the right temperature for the baby. It saves money and it is environmentally friendly. However, fortunately or unfortunately, many a times children have to be put on what is called bottle feeding. Maybe because of health problems or whatever reason, mother is not able to produce adequate milk. So, when the baby is put into bottle feeding, it is also called formula feeding. It can be powder milk or cow's milk which can be used for bottle feeding. Bottle feeding should be discouraged, however, because there is high risk of infection. Water or bottle may get contaminated and therefore infection may reach into the baby. Over dilution or over concentration. When we say over dilution, that means too much of water has been added, and when we say over concentration, that means there is lack of water in the milk. The milk is very thick for the baby to digest. Milk left out is again fed and that may get fermented and harm the baby. Sometimes if there is milk left in the bottle, mother may consciously or unconsciously may feed that same milk again. It may have got spoiled, it may have got fermented, and that will eventually harm the baby. Babies often get addicted to it and hooked to it and often gasp for air. It is expensive and often beyond affordability of common man. Baby's digestive system is not mature enough to handle nutrient composition of powder or animal milk. The baby's digestive tract is very, very delicate and very soft, but this milk is very heavy to digest, so it may harm the baby. Here you can see the schedule for formula feeding. At birth, one has to give 6 to 7 times. At the age of 1 to 2 months, baby has to be given 6 to 7 times, but the volume has increased, and from 2 to 4 months, 4 to 5 times during the day. Beyond 6 months of age, he or she has to be given 4 to 5 times a day and 175 to 200 ml. First, the baby is on mother's milk. Then the child comes into bottle feed, and the third most important feeding pattern is called complementary feeding, because only milk is not sufficient. The child feels hungry. After the age of 4 to 6 months, some kind of solid food has to be incorporated in his or her diet. In India, this is done by a function which is called Annaprashan. That means other than mother's milk, other than the milk that is being given to the baby, some kind of semi-solid food is given to the baby, and this is rich in nutrients. The process of feeding special form of family food is referred to as complementary feeding. Complementary food helps to maintain the pace of natural growth spurt. It prevents nutritional deficiencies. It varies from family to family and is largely governed by the culture, religion, education, exposure and decision of the caregiver or the head of the family what kind of food is to be given as complementary food. But it should be soft and easy to digest. There are different types of food, complementary foods that are given. Liquid can be coconut water, barley water, dal water, rice water, juices of various kinds like orange juice, tomato juice, carrot juice. When we talk about semi-solid food, it can be mashed banana, it can be porridge, suji kheer, rice kheer, or it can be khichdi or custard. When we say solid food, it is toast, biscuit, big pieces of the fruit, homemade food like soft chapatis, bread, poached fish, upma, adai, idli, khichdi, all these kinds of solid foods can be given. Now, these foods, when we give to a little baby, we have to see that once the child has been able to digest liquid food, then move on to the semi-solid food and keep giving for a continuous period of time. Once the child has adjusted to that, then only move on to a solid food. And when we are shifting into different types of food, we must be very careful that we introduce only one taste at a time. We should not introduce 2-3 types of food at the same time. Once the child, for example, if I say mashed banana, once the child has got adjusted to the taste of mashed banana, then only move on to suji kheer or rice kheer or next whichever one you want. But do not introduce 2-3 types of flavors or foods together. So today, learners, we discussed how life begins, what are the factors that are affecting the growing fetus, how we should take care of the pregnant lady, both before delivery and after delivery, what is the importance of taking good care of a lactating mother, and what is the importance of breastfeeding, and how complementary feeding is very important for enabling good growth and development of the little baby. I am sure you have had a very good learning session, learning about these facts, and you will be able to understand them better when you read in your books. Thank you.